Population health is about improving the physical and mental health and well-being of everyone in Kent and Medway. It also looks at why some people's health is better than others, understand the causes and help close the gaps. This will be achieved by the NHS, councils, public health, social care, the voluntary and community sector and the communities and neighbourhoods of Kent and Medway working together.
My name is Kieran Sahel. I'm a clinical director and lead clinical pharmacist for Dovertown PCN. The data that we were provided really highlighted that there were gaps with regards to service provision, particularly focusing around three core areas, one being mental health, one being blood pressure and blood pressure control, and the last being weight and weight management.
There was hundreds of people that met those three criteria. They've all got medical potential interventions, but also there are alternatives that can work.
There's an opportunity for us to work with other voluntary organisations and shape a shared vision, shape some core values and try and go at it in a different way.
A lot of people who were involved with the programme knew very little about what the current modern library service in Kent has to offer. So I was able to share a lot of resources that they were not aware that we even had available. I was also able to help with things like the letter that went out to the cohort of patients, because we have a strong emphasis at Kent County Council on plain English and simplifying the terms that were in the letter, making it much more patient and customer friendly. And I was able to help them take some of the jargon out, which I felt made it very unfriendly towards the public.
In most instances, we're able to refer onwards to 1U, and 1U we're able to support around what does the patient want overall? Do they want to be able to run 5k? Do they want to be able to go up a flight of stairs without feeling short of breath? In terms of mental health, it's getting an insight as to, do the patients want a referral to a mental health practitioner? Do they need just an opportunity to sit and talk to somebody about their feelings? And with regards to blood pressure, it's an opportunity to have a discussion about if we're able to manage the patient's weight by exercise, by diet, and giving the patient an opportunity to take control of their health.
You can see how beneficial it is. Obviously it reduces ED attendance, it reduces stays in hospitals. Obviously the medicines bill, which is horrendous for the country, would also depreciate. So it's a win-win situation. And at the end of the day, it's to the benefit and well-being of patients.
Jargon was a challenge for me, and I think would again be a challenge for any external partner from the NHS. And also, yes, data sharing. Understanding really what our drivers were behind the whole thing.
A challenge that we'd found was that the number of people that were picking up the phone. So, it's very difficult to make contact with someone and talk to them about their own health and well-being. It's quite a sensitive topic if you're talking around weight, blood pressure and mental health. This piece of work hasn't finished by any means, it's just a start. And it's an opportunity for us to build on the successes that we've had so far, but also to focus around individual patients and make sure that they're supported, not just by us within primary care, but the wider community as well.
With population health management and the library service, the next steps are to make sure that we can more closely join together those links and solve the problem perhaps of data sharing.
If the GP surgery plus all the other stakeholders that are involved can work with that group, or those within that group that want to work with us, then we can change their lives.